Checking in with Mercy Health St. Rita's, and we've got the hospice and home chaplain, Herb Wilker, with us today to talk more about November being Hospice and Palliative Care Month. So thanks for joining us.
It's good to be here with you, Holly. Thank you very much.
Okay, so what is it that you think people misunderstand the most about hospice and this kind of care?
I think what's come to be most recently is when people think of hospice, people think automatically that I'm not dying or that I'm not ready for it yet because I'm not actively dying or that I'm not on my deathbed. And for hospice, I believe, and many of us believe, that in order for us to do our work the best is for us to be able to get involved as early as we possibly can. If the person who's ill and who is facing their own mortality, their own end-of-life care, maybe when the determination has been made by the medical team and in conjunction with the patient and the family in their discussions and family meetings and things, that they've reached a point where treatment is no longer an option. And maybe it's time to begin to look at final arrangements per se, in a sense of making their wishes be known, making plans for how they want to be treated, where they want to be treated. Oftentimes people may think that hospice comes in and sits and holds their hands and maybe doesn't do a whole lot, which is contrary to the truth. In all actuality, we actively intervene for symptom management, for physical comfort. We actively intervene for emotional comfort, helping families and patients to work on addressing emotional needs, spiritual needs, addressing any unfinished business that they may have, which may not only include legal and financial affairs, but also emotional affairs, spiritual affairs, where we can really get in and have time to work with and process the whole experience with them.
In November, people are starting to get together for the holidays, Thanksgiving, and then we get into Christmas time. Is this the kind of stuff that families should talk about? I mean, like, what kind of care, what do they want to happen in the future? I mean, people don't like to talk about it, but should you talk about that kind of thing?
Yes, it's communication's key in anything, in any relationships, in any endeavors, work. As you and I are talking here today, communication is vital. And, even if you begin to approach the subject and begin to say, this has been on my mind, this is something I've been wanting to talk about, and I think maybe it's drawing close to this time where we need to begin discussing it. And maybe, picking the holidays may not be the optimal time because, everybody's focus may be a little different. With the festivities of Thanksgiving and giving thanks for everything that we've had over the past year and a half, 2 years, or a lifetime, and even with Christmas. But, even, with maybe a goal or an idea that, I'm going to plant a seed now and then follow up with it at another time, by identifying it, having it be something that's on my mind and then addressing it at a later date.
Yeah.
Maybe when family members aren't so distracted or there aren't so many people in the homes, where it becomes more of a personal and private conversation, with those who are closest to that person.
Right, yeah. Hospice care too, I mean, there's a facility at St. Rita's, right? Or they can come to the home. So there's many options and different things for people to talk about too, right?
Yes. You don't necessarily have to be actively dying in order to even get a hospice referral or even for us to come out and discuss and present what hospice does. Our levels of care basically is we do provide hospice care in the hospital when the symptoms are totally out of control and needing to have round-the-clock nursing care. We do most of our visits and most of our work in people's homes where most people want to be when they do die. We also go to facilities, assisted living facilities and local nursing homes to also provide hospice care to not only, again, the residents, the patients, but then also family members as well, and to assist the staff to hone in on, again, those areas of discomfort that I mentioned earlier. And again, if people, if groups, if families are interested in wanting hospice information, all you got to do is just give us a call. We'd be glad to have one of us come out to have a presentation, a question and answer conversation, so that people can all be on the same page.
All right, great information. Thank you very much for joining us today.
Holly, it's always good to be with you.
All right, don't go away. Need Edition continues in a moment.